ziua tuturor! Numele meu este Nicoleta Cristea Brunel, sunt președinta Asociației SOS Infertilitatea și astăzi mă bucur să reluăm seria de podcasturi Ce știi despre fertilitatea ta din studioul propriu al Asociației SOS Infertilitatea. Mă bucur astăzi să am alături de mine invitați din Salonic, Grecia, echipa Embryolab. Se află alături de noi domnul doctor Dimitris Michalakis, medic specialist în fertilizare in vitro, și Kyriaki Papadopoulou, una dintre cele două coordonatoare de limba română ale Clinicii Embryolab. Kyriaki vorbește limba română. Bună ziua!
Bună ziua!
Bine ați venit! Kyriaki vorbește limba română, deși este grecoaică, întrucât a studiat în România și are o parte din familie în România. Este una dintre persoanele care se ocupă de pacienții români care ajung la Embryolab. Acest podcast este înregistrat în cadrul unui parteneriat, întrucât Embryolab este Gold Partner al Asociației SOS Infertilitatea. Menționez că eu nu sunt remunerată pentru conceperea și moderarea acestui podcast. Fondurile sunt utilizate prin asociație pentru finanțarea acțiunilor asociației. O să mă întorc către invitații mei și o să întreb, Kyriaki va fi cea care va traduce pentru domnul doctor, care va răspunde în limba engleză. O să vă întreb, domnule doctor, ca să începem cu o întrebare de ordin general, când trebuie un cuplu să ajungă într-o clinică de fertilizare in vitro să vadă un medic specialist în infertilitate?
First of all, thank you for having us today. It is our great pleasure to be part of this conversation. Let me just say that it is truly remarkable all the effort that you have put in personally all these years trying to encourage and inform Romanian women and couples about infertility and fertility treatments. And I know that at Embryolab we share the similar passion to encourage, to inform women about fertility and give hope for those who are struggling with infertility. As you know, infertility is a complex disease, a disease that can affect both men and women, caused by a variety of factors such as AIDS, ovulatory disorders, obstructed fallopian tubes, anatomical abnormalities in the uterus, and also sperm issues, which is also equally important. In general, we try to motivate women and couples to check their fertility before it becomes a major concern, in order to detect it as early as possible and treat it with the proper way. So, if a couple has actively been trying to conceive for about 1 year, or for 6 months, if the woman is over 35, then it's a good idea to consider reaching out to a reproductive gynecologist who is gonna assess potential underlying infertility factors and suggest treatment options to overcome that issue. Also, recurrent miscarriages is another reason to seek a specialized care. If a couple has experienced 2 or more consecutive miscarriages, then probably she should visit her reproductive gynecologist, and obviously he gonna investigate some factors that may interfere with that issue. Other signs such as irregular menstrual cycles, hormonal imbalances, specific conditions such as PCOS or endometriosis, all these are signs that probably a woman or a couple should visit her doctor, her reproductive gynecologist, and together they will start to preparing a specific treatment plan to address these factors.
Am înțeles, mulțumesc. Aș vrea să știu, acestea sunt condițiile generale pentru a ajunge la specialistul în infertilitate. O să vă rog să le spuneți celor care ne privesc de ce ar veni pacienții în clinica dumneavoastră, ce aduceți în plus?
Well, I know that choosing the right IVF clinic can be extremely stressful and challenging for many couples. Embryolab's international department welcomes patients from all over the world daily. And to be honest, we have many couples from Romania who choose our clinic for several reasons. First of all, our clinic is known for its scientific excellence and innovative approaches to ART, to assisted reproduction technology. Before starting any type of fertility treatment, the couple will meet our clinical embryologist and reproductive gynecologist, and we will share with them, and after a thorough evaluation, obviously, we will share with them the treatment strategy as well as the anticipated success rates, which is, in my opinion, a key factor. A key factor that will open the door for a strong and trusted relationship between the couple and the clinic. Also, we always endorse transparency and patient safety at Embryolab. Our clinic is committed to strict quality standards, and we always follow evidence-based protocols in order to ensure the best possible outcome. There are no hidden costs or surprises, so the couple can have a comprehensive information at every step of their journey. Another important thing is that there is no waiting time at Embryolab. After meeting the clinical embryologist and the reproductive gynecologist, and after we have completed all the tests that we need to do, we could start the protocol and the stimulation cycle as soon as possible. Now, I know though that language can be a challenging, language barriers can be a challenging matter for many couples. And for this reason, to facilitate communication and a smooth treatment experience for many couples, Embryolab provides coordinators fluent in many languages, such as Romanian, Serbian, English, French, and other languages, which, to be honest, these coordinators serve as a primary point of contact for these patients, and they can have all the assistance and the guidance they need to go through a challenging matter, which is an IVF round, obviously. Last but not least, we're neighbors.
Yes.
Thessaloniki is really close to Bucharest, is about one hour by plane. So many couples visit our clinic for consultations, follow-up appointments, stimulation rounds, embryo transfer. Is a quite easy process for them.
Mulțumesc și o să mă întorc acum către Chiriache, pentru că tot a invocat domnul doctor acest aspect al coordonatorilor de limbă română. Spuneți-mi în mod concret care este munca dumneavoastră în clinică și cum lucrați cu pacienții români, dar cred că nu doar cu români lucrați, dar cu pacienții români, că ei sunt publicul nostru care ne privește acum.
Departamentul nostru internațional are 12 coordonatoare în diverse limbi. În limba română suntem 2 coordonatoare și angajamentul nostru este să asigurăm ca un cuplu sau o femeie, de la început și până la finalul tratamentul ei, va avea toată grija, toată atenția, toată informația, tot ce este nevoie și facilitează această experiență să fie cât mai bine trăită și fără surprize, să parcurge totul așa cum a fost planificat împreună cu echipa de medici și de embriologi de la Embryolab.
Am înțeles. Am o nouă întrebare pentru dumneavoastră. Grecia este cunoscută ca fiind una din țările europene cu legislația cea mai permisivă pentru pacienți. Ce schimbări recente au intervenit în legislația grecească în privința reproducerii umane asistate medical?
Well, the most important changes has to do with the egg donation treatment, obviously.
Yes.
The Greek legislative framework has changed recently and allows these treatments to women until the age of 54,
Yes.
giving hope for these women to become mothers later in life. Also, we have a few changes in the egg freezing program. Nowadays, women can choose to freeze their eggs only for social reasons, and there isn't any age limit for using these eggs in the future.
Vorbind despre egg donation, despre donarea de ovocite, într-adevăr, Grecia este cunoscută ca fiind una din destinațiile europene favorite în materie de ovocite donate. Aș vrea să vă întreb, domnule doctor, care sunt opțiunile pentru femeile de peste 40 de ani care își doresc să aibă un copil?
Well, women that are interested to go through the egg donation treatment and are over 40, they will contact our clinic, and later on we will go through a thorough evaluation. First, we need to see her medical history, we need to see her previous fertility treatments and assess any potential factors that may have an impact for the future treatment. We need also to see if we're gonna use a sperm sample from a possible husband, or if they will go with a double donation program. This means
Yes.
egg and sperm donation. After a thorough evaluation, we will need to give a few insights to her. This means that we will try to provide information about the criteria that we use, the strict quality criteria that we use in order to select an appropriate young lady. In fact, in the egg donation treatment in our clinic, we focus on selecting the appropriate person for each woman. We accept only women below the age of 30 in order to have eggs of excellent quality and subsequently embryos of excellent quality. A specialized team is responsible to find the appropriate person according to the phenotypical characteristics of the recipient. And after finding this young lady, she will need to go through several tests, meaning physical examination, gynecological examination, genetic tests, and psychological evaluation in order to confirm that she is a healthy young lady. Only after passing all these tests, she will start, as you know, her part of the treatment. You will need to go through a stimulation round in order to stimulate the ovaries and collect the eggs. Then the important thing is that our embryologist will fertilize the fresh eggs, and our goal is always to create day 5 blastocyst stage embryos in order to reach the highest success rates. At this point, in our clinic, we have the technology to monitor closely the embryos. That's why we have new programs, the artificial intelligence and incubators with time-lapse technology, which will help us enhance our ability to select the best embryo for the future embryo transfer. And to be honest, we have seen excellent results with these new programs, as it seems that we can reach higher implantation and ongoing pregnancy and live birth rates eventually.
Concret, despre ce este vorba? Cum poate inteligența artificială să ajute o echipă, niște medici specialiști în fertilizare in vitro?
Well, in the artificial intelligence program, there are a few algorithms, and combined with the time-lapse technology, we have a score. And before utilizing these systems in our clinic, we combined the score that we found in several embryos with the outcomes that we have in the end. and we found that we had comparable outcomes, and when we used the artificial intelligence with the experience of our embryologist. However, just recently we saw that the artificial intelligence, the score that we have from these programs, from these
Yes.
algorithms, can give us a better chance, let's say, a better opportunity to select the more viable embryo, the embryo that could lead to higher implantation rate for the woman. So it is an opportunity for us. It's something that we use. It's something that we propose in order to have better reproductive outcomes in the end.
Da. Și vreau să vă întreb apropo de această emergență a inteligenței artificiale. Ce credeți că se va schimba spectaculos în următorii ani în acest câmp al reproducerii umane asistate medicale, în acest domeniu?
Well, this is a quite good question. Well, we expect more innovative approaches and techniques for the future. We have also some studies and reports about the non-invasive pre-implantation genetic testing, and we really hope the IUI to we really hope to combine the artificial intelligence, the time-lapse technology, with less invasive techniques in the future, because there are reports showing that maybe a little damage on some blastocysts with the pre-implantation genetic testing, and we always try to eliminate, to minimize these risk factors. And I hope in the future to have less invasive methods that will provide to our patients the highest success rates.
Aș vrea să vă întreb, domnule doctor, despre cum abordați la Embryolab toate aceste aspecte și ce faceți pentru ca a sfătui cuplul sau femeia pacienta care face apel la dumneavoastră să vină cât mai pregătită anterior procedurii. Ce consiliați pacienții să facă înainte de procedură pentru a maximiza șansele de reușită?
Our clinic is composed of many people, more than 100 people, and all of these will guide will have a role. They have a significant role in order to help a couple be prepared for its IVF round or for an egg donation treatment. We have experienced reproductive gynecologists, clinical embryologists, coordinators, psychologists, and support staff who will guide them through the way at every step of their journey.
Tocmai pentru că am vorbit de această pregătire anterioară fertilizării in vitro, ce ne puteți spune, venind dintr-o țară mediteraneană și însorită, despre rolul vitaminei D în preconcepție și în concepție?
Well, vitamin D is of great importance when it comes to fertility. We all know, obviously, that the primary source of vitamin D is sun exposure. And there are some studies in the literature showing that adequate or increased levels of vitamin D have been linked with higher reproductive outcomes. Some studies suggest that vitamin D may play a role in reproductive hormone regulation, follicular development, embryo implantation. But to be honest, we need more research to understand these underlying mechanisms and probably to determine which are the optimal levels of vitamin D to achieve a successful outcome. Of course, in terms of sun exposure, we always need to take a few precautions, such as wearing sunscreen and proper clothing. In the end, the couple will meet with the reproductive gynecologist, and according to the vitamins, according to the levels of vitamin D, he will suggest specific vitamins or specific supplements in order to try and increase these levels to reach higher success rates for the future.
Care este această filozofie a Embryolab și a Academiei pe care dumneavoastră o aveți în cadrul Embryolab?
At Embryolab we count now 20 years, more than 65,000 IVF cycles and thousands of births. Our philosophy is rooted in personalized care, cutting-edge technology and innovative approaches, as well as evidence-based protocols in order to provide the highest quality of care for our patients. Well, if we want to share a few key factors of our strategy, this would be holistic approach. A holistic approach means that we do not only address the medical aspects of infertility, but we also try to support women, to support couples through psychological support and guidance at every step of their journey to parenthood. We also use only evidence-based protocols according to the latest scientific evidence. We are really proud for our lab. The lab at Embryolab, as I always say, is the core, is the heart of our clinic, and our embryologists have developed an ideal environment for the embryos, a heaven, as we say, for the embryos to thrive and develop, utilizing cutting-edge technologies and expertise in various techniques. And in various techniques, as we say, I would say, such as on challenging matters, such as the PGT, vitrification, or microthese, where we have excellent results. Now, regarding the Embryolab Academy, as you know, Embryolab Academy has the role of education and training for many couples, for many reproductive gynecologists and embryologists worldwide. And I would say that this effort put us at the forefront of the innovative technology of assisted reproduction.
Am înțeles. Vă mulțumesc pentru toate aceste detalii. Vă mulțumesc pentru prezența dumneavoastră în studioul nostru. Vă urez mult succes și cât mai mulți bebeluși care să se nască și să-și facă părinții fericiți. Vă mulțumesc și dumneavoastră pentru că ați urmărit acest podcast care este o parte din parteneriatul pe care Asociația SOS Infertilitatea are cu Clinica Embryolab din Salonic, Grecia. Vom continua această serie de podcasturi cu medici, cu invitați din sfera reproducerii umane asistate medical. Vom încerca să avem și persoane din sfera politică, vom încerca să avem și pacienți și vom încerca să vă oferim informații utile despre infertilitate, reproducere umană asistată medical, fertilizare in vitro și în curând și despre adopție. Vă urez o zi bună și vă mulțumesc! La revedere!